Hi, I'm Dr. Julie Went, and I'm going to teach you how to use an HFA device. And there's several of them out on the market. So this is an example of one. And here is albuterol, which is also in this particular device. So we call it the puffer for short. First, I want you to see that if for any reason you need to know the expiration date, you can actually take it out of the device and you can look at it, and it is right about there. So I don't know if you can see it, but it says it expires February 29th, 2024. And it also gives the lot number information, which is important. It gives the number of doses left. Since my albuterol is completely run out, I feel pretty comfortable using it. There may be some residual, but I don't think I'm going to get much of an impact from using it for no particular reason. And that's important. You should keep track of how much there is in there, because it may not be enough if you really need it. And so pay attention to how many doses you have left. When you're starting to get close, you should really call for a refill. Well, anyway, so one thing I want you to notice when you first get yours, and you really can't see this with this particular device because it's really out of medication and has been so for a long time. Shake it and look, oh, we got a little bit. And so you saw how long the stream is. That, I'm going to tell you, helps the liquid in here make an aerosol that you can breathe in, and then it layers on your lungs where it has the effect. The second point I want to make about that is if you put it in your mouth like this, which I see a lot of people doing incorrectly, and puffing, it's going to hit the back of your throat. And while some of it will get to your lungs, especially if you inhale, there's just not enough time for it to be aerosolized. So it really needs to have a little bit more distance. I prefer an open mouth and right about the front of my mouth. It doesn't need to be out here. It doesn't need to be out here, but it does need to have some distance in order to effectively get where it needs to get, which is down in your lungs. I recommend the open mouth method. So rather than closing your mouth on the device where the distance between the inhaler and the back of your throat is really short, and if your tongue gets in the way, most of it is going to get dispersed on the tongue, and that's not helpful for anybody. But take an open mouth and do some inhalation and exhalation. And after you do it a few times, you'll realize your tongue flattens, and you do want a flat tongue, because if your tongue gets in the way, again, you're going to hit your tongue. So once you've done that, on an inhalation, you're going to puff at the same time and inhale. So it does require a little bit of timing. So take a deep breath out and open your mouth, inhale, and puff at the same time. Hold your breath 10 seconds. Okay, in the real deal, you're really not supposed to talk. So I'm going to try that again all at once. And I recommend that you do it in front of a mirror and watch for curls of smoke. That shouldn't be happening. It should all be inhaled. I want you to feel what you feel like in 15-20 minutes, which is about how long this time to take effect, and notice what the distance was so that you can reproduce what works the best for you. Again, open mouth, take a deep breath out, take a deep breath in, and puff and inhale at the same time. Then hold for 10 seconds. So let me do that all together at once. You may have the need to cough, and that's just bronchospasm and your airway muscles just kind of loosening up a little bit. Not terribly abnormal, but it may actually be helpful if you're not feeling good, because you may get some help coughing things out. So all of these are used that way, with the exception of anything that has a steroid in it as well, you should rinse your mouth out with water, and just a quick rinse, gargle, spit is all you need, nothing fancy. And that's how to use an inhaler. I hope that helps.